Hi, everyone. We are just getting started, so we'll give folks a couple of moments to join in. Okay, it looks like the attendee numbers have slowed down, so we'll get started. My name is Kaylin Pettit. I'm the Director of Communications and Marketing at Hamilton Health Sciences, and I'll be moderating today's conference. To start us off, thank you for joining today. We do have 4 leaders from McMaster Children's Hospital here to provide an update on the situation at the hospital. I'll introduce them now, and then we'll get right into it. So today we have with us Bruce Squires. He's the president of McMaster Children's Hospital and the vice president of Women's and Children's Health. We have Dr. Angelo Mikrogiannakis, chief of pediatrics at McMaster. Dr. Devin Peterson, who is Chief of Pediatric Surgery at McMaster Children's. And we have Leslie Gillies, who is Vice President, Community Medicine and Population Health. So now I'll turn it right over to Bruce, who will provide a situational update, after which point we'll open it up to media partners for questions. Over to you, Bruce.
Thanks very much, Kaylin, and thank you all for joining us today. Appreciate the opportunity to provide an update on our situation here at McMaster Children's Hospital. Like pediatric hospitals, children's hospitals across Ontario and really across Canada, McMaster Children's is under immense and increasing strain. This is caused by a surge of viral illness in children and youth, but it's also compounded by ongoing staffing pressures and further exacerbated by the impacts of delays in care for children and youth that we've experienced over the course of the pandemic. Inpatient occupancy for pediatric beds at McMaster Children's Hospital is extremely high, hovering around 130 or 140%. And the daily average of patients presenting at the McMaster Children's Hospital ED as of late has been nearly 200 per day. This is consistently 20% higher than our historical averages. What this has meant is exceptionally long wait times in our ED, and especially for patients who are requiring admission. They're often waiting well in excess of 24 hours. The number of patients having to wait in an emergency department for an inpatient bed is up 225% over our historical average. This situation is truly unprecedented, and the team at MCH and across Hamilton Health Sciences is putting forth extraordinary effort to manage this healthcare crisis. I am personally so grateful to every one of them. To address these challenges, we're taking in a wide variety of actions. We've expanded the footprint of our emergency department into other parts of the hospital so as to respond in the surge in volumes. We've opened additional beds on our inpatient units to care for the increased number of children and youth who are requiring hospitalization, including in critical care. We're leaning on virtual care appointments where they're appropriate to support families at home and to prevent unnecessary emergency department visits. We also are adjusting the number of daily surgical cases that we're performing. We're concentrating on same-day home surgeries, those that don't require hospital admission. We're doing this given the lack of inpatient bed availability. We've reduced our pediatric surgical activity requiring a hospital admission to 1 case per day or less than 5 per week, which is down from more than 15 per week. This, of course, may impact wait times for some surgeries, and it is very concerning to our surgical teams. We're working with our regional hospital partners to ensure an optimal use of pediatric capacity across all of the region and the province. Where possible, patients are kept in or sent to other hospitals with pediatric beds. Our partners, however, are also experiencing unprecedented volumes, and so that's requiring us to work collaboratively and cooperatively to support each other. We're temporarily modifying the MCH catchment area so that patients at hospitals and those transported by ambulance in the Kitchener-Waterloo, Wellington County, Cambridge, and Guelph areas are being sent to the Children's Hospital at London Health Sciences Centre instead of to MCH. We're truly grateful to our partners at London Health Sciences. Now, this includes pediatric patients from Grand River Hospital, from St. Mary's General in Kitchener, from Cambridge Memorial, from Groves Community Memorial in Fergus, and from the Guelph General Hospital. This change doesn't apply to our NICU, our neonatology patients who will continue to come to MCH, or critically ill children who continue to be transferred and really managed via the Ontario-led Critical process, which ensures that they have access and are cared for in the appropriate and most available pediatric ICU bed and site. We may also need to transfer some older teen patients requiring medical care and critical care to other HHS sites. As of today, we haven't transferred any patients within NHS. Transfers only apply to medically suitable patients, following discussions between the pediatric and adult teams and physicians, and where the treatment for the pediatric patients would largely be similar to that we would provide for pediatric patients at MCH. Staff and physicians at the Juravinski Hospital caring for pediatric patients are going to be remotely supported as necessary by their colleagues at MCH. And both teams will continue to evaluate these services as and if they unfold. We've also collaboratively implemented here at McMaster Children's the provincial direction that provides for care of some teens, 14 plus, in adult community hospitals around the province. Those are hospitals that also have pediatric capacity. As well, we've implemented protocols that support the transfer of 16 and 17-year-old surgical patients as appropriate from McMaster Children's to the Juravinski and Hamilton General Hospital sites of HHS. The Juravinski Hospital would support general surgery, plastic surgery, and urology surgical cases, while the Hamilton General Hospital will support orthopedic, trauma, orthopedic, trauma, and ENT cases. Now, I do want to note at this time that trauma patients who are 16 years of age and older currently and for many years have received care at the Hamilton General Hospital if required. So we know our teams have this capability and capacity. Again, we haven't transferred any MCH patients as of today, and the decisions about this will be made on a case-by-case basis as necessary. Now, we certainly recognize that the impact of these very difficult decisions is large and troubling for some patients, parents, and families that we serve. We're grateful for their patience as we make these changes only to ensure that we can maintain continuity and access to the highest quality of care for critically ill children and youth in our community. I want to take this opportunity as I close to sincerely thank and to appreciate the work of all of our staff and physicians in supporting our patients and families at what is a very difficult time. With that, Kaylin, I'm pleased to turn it back to you.
Thanks so much, Bruce. So now we'll open it up to questions for media partners who have them. So we'll allow one initial question and one follow-up per participant. If you have a question, just raise your hand and we'll go in order. Okay, first we have Joanna from the Hamilton Spectator. Go ahead, Joanna.
Hi, thanks so much for this today. The first thing I want to ask is, have you had any aid or any type of solution or any type of plan come from the province to help McMaster and the other children's hospitals in the province during this time?
Oh, thanks very much for the question, Joanna. And I'll start off by saying that that McMaster Children's, along with children's hospitals from across Ontario and community hospitals, have been meeting with and working with government, with each other, and with other community partners in looking for a number of different solutions that can help us. One thing will be the single best fix in managing this extraordinary time. The province has provided us with additional financial support to allow us to work to expand our emergency department care opportunities through pathways within the hospital and at our urgent care sites. We have had support in opening our additional beds, and we do have support in working with our partners under the support of Ontario Health, one of government's agencies, on a daily basis to drive capacity and flow. There's no question that to meet the ongoing and continuing demands, we're going to have to continue to work together across all levels of the health system.
Thanks so much for that. Are you able to give us a number on how much financial support that you've received from the province for expanding the emergency department and opening new beds?
Yeah, thanks, Joanna. The province has flowed $1.3 million prorated to, and I want to be perhaps more specific, to allow us to enable alternative pathways to help to support our emergency department volumes at this difficult time. And we're using those funds in a number of different ways to ensure that we have appropriate pathways for children and youth who may not require the highly specialized care of the McMaster Children's Hospital Emergency Department, but do need to receive assessment, care, and potentially treatment.
Thanks, Bruce, and thanks, Joanna. Any other questions?
From me?
In general, thanks.
I would love another question if I have the time. Yep.
I just have Jason has raised his hand, Joanna, so I'll go to him first. I'll just give everyone a chance to ask initial questions and then we can do another circle. So Jason, go ahead, and can you just introduce yourself and your outlet, please?
Hi, yes, everyone can hear me, correct? Hello?
Go ahead.
Oh, sorry, okay, yeah, sorry. I still don't have a grasp on how many are actually hospitalized.
Jason, sorry, Jason, your audio is really choppy. Could you try speaking up?
Hello, can you hear me?
It's a little better. Still not clear though. You can also type, if you'd like, you can type your question in the Q&A function if that's easier.
Sorry, my chat isn't stable.
Okay,
I'm sorry, you know what? Try to go again. Like, sorry.
Okay, having a hard time hearing Jason. So let's Jason, feel free to put your hand back up in a few minutes. Yeah. Okay, any other questions? Okay, not seeing any hands. Joanna, did you want to go ahead?
Thanks so much. The province has not put in a mask mandate. They've only put in a strong recommendation. Does that go far enough? Would you like to see a mask mandate? Do you have any confidence that people will mask with just a recommendation?
Do you want, I can take that.
Yeah, go ahead, Leslie, thanks.
Yeah, so certainly we do support Dr. Moore's strong recommendation on masking indoors and encourage everyone to wear a mask, get their COVID vaccine and booster, and to get a flu shot, including children. So, and has been from the beginning noting that masks are mandatory in all of our hospitals. So certainly can comment to that and hope that addresses your question, Joanna.
Thanks, Leslie. Jason, go ahead and try again.
Hi, can you hear me now?
A little better. Yeah, go ahead.
Okay, sorry, just on a side note, my chat, I can't, it's disabled right now, I can't send it. So, that's to speak up. Sorry, I'm just out of curiosity, up to date today, what is, like how much capacity is MCH at this point in time?
Jason, I'm sorry. I don't know about others, but I'm still having a really hard time hearing you. Your audio is not clear.
Sorry, also my chat is disabled in my,
There is a Q&A function within Zoom. You can try the Q&A function
okay.
alternative to the chat. We'll just give Jason a moment. Joanna, do you have a new question?
I do, thanks. I'm looking to see how you're doing on supplies. The update that came out last week said that you're running low on supplies. What supplies are you running low on, and how low are you?
Thanks very much, Joanna. Maybe I can pass that question to Dr. Michael Janakis, who can speak to some of the challenges we're experiencing in the ED.
Thank you, Joanna. The main challenge in terms of things we need to care for patients is on the human resource front in terms of staffing and skilled staff to care for sick patients. There are challenges within the system that exacerbate this, and when parents have unwell children, things that they can do to help them feel better. So the current capacity surge is challenged even more when there's not enough Tylenol or Advil in the system, as well as common antibiotics shortages in the system. I know that various levels of government are working to correct those things, but in a capacity surge, you need all aspects of the system working at above regular capacity to be able to deal with these things. So the main shortages from a medical perspective were around some common antibiotics and some Tylenol, and we're hopeful that solutions will be coming forward in the short term to help with that part of the equation.
And I'll add to that we are now starting to experience some challenges as we've expanded our bed capacity with some of the other equipment associated with care for these children and youth. Things like pumps that are really for timely and appropriate medication administration, and also really uniquely cribs. Certainly this surge is particularly impacting younger children, and so we're starting to exceed our supply of appropriate beds, cribs, for these children. And so working with partners, hopefully to address that. But it really speaks to the magnitude, Joanna, of the surge that is pressuring us right now.
Thank you. So I see that Jason has posed his question in the Q&A section, so I'll just read that out. And Bruce, perhaps you can start this one. So the question is, what's the capacity right now at McMaster Children's?
Thanks very much, Jason. So I think what you're really asking is what's our occupancy relative to our baseline capacity, and as of this morning, our occupancy was 130% in our inpatient pediatric units. That as well, we had 15 patients who had been admitted to an inpatient bed, but were still in the ED because we did not yet have the staffed and bedded space to accommodate them. Our ICU was on the level 3, so the most specialized and advanced ICU beds for the sickest of kids. We were running at 109% capacity. We had surged into other parts of the hospital. Those numbers really have been unfortunately quite consistent over the last month. And we anticipate them to continue to be at similar levels going into the next few weeks.
Thanks, Bruce. Joanna, is that a new question?
Yes, it is, if it's possible. I'm looking to find out, can you talk a bit about what it's like for your staff and for parents at the hospital right now, whether they're inpatients or whether they're in the emergency room? Like what is it like there? What is that atmosphere like there?
Thanks very much, Joanna. It is absolutely extremely challenging for our staff as they support but also empathize with families and with these children. I'd like to invite Dr. Peterson to share some of his reflections.
Yeah, no, thanks, Bruce. Joanna, it's a great question, and thank everybody for being here and sharing this message, which I think is very, very important. I think the stress level, you know, for the parents, for the children, for the staff, for everybody in the hospital right now is very high. It's when you look at some of these meetings, and I look at some of my colleagues that are working in the trenches. My heart bleeds. I mean, they're really just every day, just going more and more. So you know, thankfully we have such a great team at McMaster Children's Hospital, and so much support, so much understanding between groups, the surgery group, the medicine group, the ED, the PICU, everybody really working together here. You know, it's been tough. I mean, you know, Bruce has outlined some of the surgical things, and if I can maybe take a few seconds to go over what we've changed to help accommodate these really sick children, where we've gone down to 1 admission a day. I'll talk maybe a bit more about that in just a second. We sort of tried to supplement our cancellation with same day home surgery so we can keep, you know, treating children as well. We've had the protocol that just opened up last weekend, where we will be sending some 16 to 7-year-old you know, patients that require inpatient emergency surgeries at McMaster Children's Hospital. The proper ones will end up going to the Dravinsky and the general as time moves out. We've even started to talk to our group about scheduled surgeries, and if you have a 16 or 7-year-old, can we send these patients to somewhere else to get their surgery done? The philosophy we're using is pretty strict. We're picking patients. It's really, if we think over the next 4 weeks that they'll have significant morbidity or even you know, serious complications that they're not able to be done at this time. This is very stressful, and we're really making decisions on a daily basis. Thankfully, the team that I have under me, all my surgeons are incredibly well trained. They're a group that works very well together, and these decisions are made not lightly, and they're made with good evidence. So they're really made with surgeons that are very good at understanding patient conditions. But even today we had to switch a patient out. You know, the decision was on Monday whether we did a patient that had a tumor, we did a patient that might lose bladder function. These are sort of decisions we're making. Again, they're being made safely. It's being made with a group that is so understanding of these conditions. But this is a situation we're at in surgery, and it's very difficult to make these decisions. I think the stress level is high. You know, we haven't recreated the wheel. We've put together a framework that was used during the early parts of COVID to help with these decision making, which has been very, very important. And we've had extremely good support, innovative thinking, out of the box ideas from many parts of the hospital, and getting these patients done that really need to be done. So thankful to all my colleagues on this call and everybody in the hospital for working so hard at this point to continue the flow of these important surgery patients.
Thank you, Dr. Peterson. Any other questions from those who haven't raised their hand yet? Okay, I wonder if just in closing, if perhaps Dr. Mikrogiannakis, you can speak briefly to families and the public at large of, what they could maybe do at home to, in light of a severe infectious season, in terms of, prevention, but also should their child get sick, how do you know where to go and when, and how to navigate the system, knowing that ED wait times are very high right now?
Thank you, Kaylin. No question, it's a challenging time for families with small children, and especially when the family's unwell or when they get sick. Trying to do our best to mitigate illness or minimize illness or prevent illness would be the first strategy. And that's where the strong recommendation around masking has come. We know most of these respiratory viruses are spread through coughing and through regular interactions. Clearly, masking worked when we were focused solely on COVID as the main virus we were trying to prevent. Now the problem is with all these children getting sick at the same time, it overwhelms the capacity in the hospital systems and the care systems. So influenza vaccination to minimize illness and severity of illness, along with masking to prevent our children from getting sick, or if they are starting to feel sick and coughing, from spreading it amongst other children. Once your child is unwell, obviously families want to make sure that they're being assessed and cared for. Our request would be that families explore the appropriate level of access in the healthcare system to get their child assessed. So your family physician, your family medical team and their availability, your community resources, urgent care centers, we're increasing our education and our support to all of these areas to expand their comfort and potentially their capacity for dealing with regular viral illness within children. Once it becomes difficulty in breathing and respiratory differences as opposed to coughing and fever, again, your community hospital can help initiate things and then help to triage which children need to be admitted, which children can stay close to home in their community center, and which children might need to go to a higher level of care, such as a children's hospital. So I guess those are the best ways I can summarize: trying to mitigate the level of illness in your own home, in your own family, and in our communities through immunizations and beginning to use masks again, and then appropriately accessing the healthcare system at your local levels so that singular areas aren't overwhelmed by the number of patients, that we can try and care for all the patients needed through our community partners in their offices, through our regional emerge departments and urgent cares, and along with our children's hospitals supporting them.
Thank you, Dr. Mikrogiannakis. Unless there are any further questions, we'll wrap. If you do have a follow-up, please follow the usual process for media inquiries to HHS. We're happy to work with our experts to get your response. Joanna, one final question. Go ahead.
Thanks so much. I'm looking to find out, where things are going from here, where you expect them to go from here. I know you don't have a crystal ball, but is there any sign of this peaking yet? Or do you only expect it to get worse over the winter months when you traditionally sort of have this respiratory season? Like, what are we facing here in the coming weeks and months?
Maybe I'll take the first response to that, Joanna, and then I will refer it to Dr. Mikrogiannakis. Certainly, we are planning for this to continue, and for the possibility that the convergence of RSV, influenza, COVID-19, and other viral illnesses, along with the impacts on delayed care, will cause this to surge even further. There's a lot of time left in what is traditionally the children's viral season, and so we really have no choice but to plan for the possibility that this will continue and in fact get worse. With some of the measures that we've talked about from a public perspective, and certainly the actions that we're taking to try and mitigate, we're hopeful that we can improve things, but we really do not have the option to do anything but to assume a continuation. Maybe I can turn it to Dr. Microjanakis to just say a little bit more about the fall viral surges and what that really means in most years and potentially this year.
Thank you, Bruce. Thank you for that question, Joanna. Pediatrics goes through respiratory illnesses every winter, and we go through a surge that challenges our hospitals and our capacity on a regular basis. In a regular winter, our pediatric teams have about 40 patients admitted in regular times, and in winter surges, we need to have 55 patients in the hospital during the regular viruses of RSV and influenza. With the success of what we did against COVID by using masks and preventing viral illness, what we're seeing now is we are going to have 3 winters combined into one. So the winter surge of 2020 that never happened, the winter surge of 2021 that didn't happen, and now the winter surge of 2022, the young children that haven't seen these viruses before, the RSV virus, the influenza virus, and some of our other common viruses are all getting sick at the same time. So where our previous surges would push us up to needing 55 inpatient beds at the Children's Hospital, we are now at 75 to 80 inpatient beds and straining the intensive care unit and the wards. So my simplest way of describing this is we are seeing 3 winters in one, 3 winter surges in one. And we've started earlier than we usually do. Usually the winter surge begins in December, peaks in January, February. We saw this starting in October and now November. And so it's going to be longer and likely require more supports from a hospital system and challenge our hospital capacity and our responsiveness to sick children and our supports for sick children more than we've probably ever seen in my career.
Thanks, Angelo. Okay, so we'll wrap there. Thank you again to all of our leaders and media partners for making time for this today. Again, if you have follow-up questions, please send them via email per the usual process, and we're happy to respond. Otherwise, thank you, everyone, and take care.